Hey everyone, I'm Soren, one of the owners of Smile Now Dental Group. If you're considering All-On-6 dental implants, one of the things you might be wondering is how long does the recovery process take? How soon can you eat, talk, and get back to your normal life? In this video, I'm going to walk you through the step-by-step recovery timeline, what you can expect after surgery, and how modern technology and in-house procedures help speed up the healing process while also keeping you comfortable. So first, let's talk about what actually happens after getting your All-On-6 dental implants. Unlike traditional implants that might require 3 to 6 months of healing before getting the teeth or the tooth on a single implant, All-On-6 dental implants allow for immediate function. And that's one of the benefits of fixed prosthetics is we can load these across the arch and you're able to function on them immediately. That means you walk out of surgery with a full set of teeth the same day. But your body still needs some time to heal and fully integrate the implants. Integration is the process where your bone fuses to the implant to kind of form one. So it allows that implant to function in your jaw, same way as you would if you got a hip replacement. How long does the recovery process actually take? Let's break it down a little bit for you. So the first 24 to 48 hours, that will be your immediate post-op care. Right after surgery, you'll likely experience swelling, some mild discomfort, and possibly some minor bleeding. Usually we'll see bleeding happen, that first 24 hours. And this is completely normal. We provide detailed post-op care instructions, and we will also prescribe some pain medications and recommend some other medications as well. Most of our patients typically get a painkiller, a steroid, and an antibiotic after their procedure. Most patients can go back to light activity within 24 hours. We advise resting as much as possible, especially if you're still in pain. It is really patient dependent. Some of my patients, they go back to work the next day. I don't necessarily recommend that, but other patients are still quite a bit sore at around the 1 week, 5 days to 7 day mark. We do recommend a soft diet though during this healing process. And I like to tell my patients, you can have anything that you can cut with a plastic fork. I want you to stay away from nuts, apples, hard vegetables, things like that. But you can eat soft meats, noodles, anything that you can cut with that plastic fork. So that's the first 24 to 48 hours. Next step is the first week, and that's kind of our initial healing period. Typically, you will find swelling and tenderness will peak around day 2 to 3. Some of my patients feel great the day after, but then it starts to creep in on that 2 to 3 day mark. After day 3, we'll typically gradually see a decrease in that swelling and pain. Sticking to soft foods and avoiding anything too hot or spicy will prevent any irritation from happening. By the end of the first week, most patients will report feeling much more comfortable and most of that swelling will significantly reduce. Typically in this period, we'll also see some bruising, depending on how easily you bruise as a patient. And this, again, is very patient dependent. At our offices at Smile Now, we schedule a post-op checkup. I like to see my patients at 1 week and 3 weeks. Some providers like to see them just at the 2 week mark. I wouldn't say one is better than the other. I just like to see how my patients are doing at those two crucial points. So after that, we have our first month of healing. In weeks 2 to 4, your body will begin that process of integration. It's actually, or the correct term is osseointegration. And that's where the implants start fusing with your jawbone to kind of form one. And while you might feel completely fine at this stage, the implants still need that time to integrate, and we still don't want to be eating those hard foods. We want to be sticking to that soft food diet. And I tell my patients, until we get to that zirconia prosthetic, or until we get to whatever material that you choose for your final prosthetic, I want you sticking with those soft foods. The next step is that 3 to 6 month mark. And that's when we kind of get that full healing, and that's when we start that permanent teeth process. So within that 3 to 6 months, that's when most of our patients completely heal. And occasionally we will get some implant failure, and most of the time it happens in that first 6 month period. So we're able to swap that implant out prior to going to the final prosthetic. Implants do have a very high success rate. That being said, when you're getting 10 implants, 12 implants in your mouth, occasionally we'll have one that fails and then we'll just replace that for you. Once the implants have fully integrated, however, we will then start that process of the final teeth. We'll replace those temporary teeth with your custom designed permanent prosthetic, And that's where you will get that long-lasting, beautiful smile that feels and functions like your natural teeth. I, in my office, will go through as many sets as it takes to get you to that point where your bite feels good, the aesthetics are where you want, and you're happy with those teeth before going to your zirconia final. At Smile Now Dental Group, we do everything possible to make sure your recovery process is as smooth and as comfortable as possible. And this is how we help at Smile Now. We use modern technology and minimally invasive techniques. So our implant placement reduces trauma to the surrounding tissues, which will mean less swelling and faster healing. The reason we're able to do this here is because our teams are very efficient, and we want to make sure you're not in surgery for a super long period of time. That's typically where we see a lot of that swelling and bruising take place. That being said, it can happen to any patient. Additionally, we have an in-house lab here, so everything from the surgery to your temporary restoration are all done in-house, and that ensures consistency and it reduces treatment time. We also have personalized follow-up care. So we will check on you regularly to monitor your healing progress and make sure that we give any kind of expert guidance that you need. Also, if you ever are having any issues during that healing process, you can call our office at any time and the doctor will talk to you directly. So if you're ready to restore your smile with All-On-6 dental implants, please reach out to one of our offices. We would love to help you out. Again, I'm doing these videos just to help patients in general who are getting this treatment done. I do think that at Smile Now, we provide the best possible care that you can have when getting this procedure done. We are doing 6 implants whenever we can. All of our providers have been trained to the top abilities, and I think you will get a really good care if you choose to go with Smile Now. That being said, wherever you end up getting your treatment done, I hope these videos are helpful for you. And please let us know if you have any questions at all. You can send us a question on Instagram, or you can send a comment down below and I'll be happy to answer them. Thanks so much. Bye.